Welcome back to the CoC training. We're moving from CoC 101 now to CoC 201. CoC 101 really gave you the basic bones of what is a continuum of care, what is its role in the community, who is involved in a continuum of care, what is coordinated entry, and some other key basics. So we're moving on to a little bit more advanced topics around CoC that hopefully will help build on what you learned in CoC 101. So CoC responsibilities. I'm going to recap this. Hopefully you've watched the Module 1 trainings and you are familiar with this. This won't look new to you. But to recap, the responsibilities of the CoC are to operate the continuum of care. That means hosting meetings, inviting new members, selecting a board, and appointing committees or work groups. CoCs have to develop a governance charter. CoCs have to establish written standards for CoC and ESG assistance. CoCs have to evaluate performance for the programs that receive CoC funds. CoCs have to establish a coordinated entry system, as well as design and operate that homeless management information system, HMIS. CoCs have to plan and conduct the point in time count. CoCs should be coordinating with consolidated plan jurisdictions, ESG recipients, really working with the other folks in the community who are addressing homelessness and establish a community plan for delivering that assistance, and then apply to HUD annually for funding. So let's talk about the collaborative applicant. So each CoC has a collaborative applicant. And for the Western PA CoC, that's DCED. And the collaborative applicant really acts on behalf of the CoC when applying to HUD for grants. The responsibilities of the collaborative applicant should be outlined in your CoC's governance charter. The CoC retains its duties related to planning and prioritizing need. But when you're talking about signing off on grant agreements with HUD and things like that, these are really things that the collaborative applicant is doing on behalf of the CoC, for example, for planning funds. Just a note, CoCs are not required to be legal entities. Some communities, the CoC may be a nonprofit, but it's really more about a body. So the collaborative applicant responsibilities are submitting the application annually to HUD. It's called the consolidated application, and this is really an application that kind of outlines all the things you've been doing over the last year to address homelessness and how your CoC is performing. The collaborative applicant applies for CoC planning funds on behalf of the CoC and participates in the development of the governance charter within the CoC. So let's talk about CoC planning activities. I've mentioned this a couple of times. So collaborative applicants may use up to 3% of their award, we'll talk about these acronyms a little bit later, for costs of planning. So the planning cost includes designing and carrying out a collaborative process for developing the application to HUD, evaluating outcomes for CoC and ESG programs, participating in the consolidated plan, and other planning activities include developing a community-wide or region-wide process that coordinates all these different folks who are serving folks experiencing homelessness, determining the geographic area that the CoC will serve, developing the CoC system, evaluating outcomes of projects, that includes both CoC and ESG, participating in the consolidated plan, so really partnering with other folks who are working to address housing and homelessness, and then preparing and submitting an application to HUD on behalf of the entire CoC. That also includes conducting that point in time count, as well as other data collection requirements that HUD has throughout the years. CoC planning costs can also cover monitoring, so the cost of monitoring folks who receive CoC monthly and making sure they're compliant. So that's CoC planning in a nutshell. When you hear the term CoC planning grant, this is that up to 3% of the CoC's funds, which can be used for fulfilling all these responsibilities. It's a big job. Next, let's talk about the CoC Board. So the CoC Board must be established by the CoC to act on its behalf. On its behalf is kind of a vague term, but in your CoC governance charter, you need to outline what the board's role really is. So the board is not the same as the CoC collaborative applicant. The CoC collaborative applicant is the one who does kind of the applying to HUD for money and facilitating all these activity. The board is really guiding a lot of the work in the CoC. So the board needs to include relevant organizations and folks who serve homeless populations, must include at least one person who's homeless or formerly homeless, and a board members can also kind of represent different types of interests. We'll talk more in a future module about the role of the board and what the board looks like in the Western PA CoC. The CoC governance charter. So the CoC must develop and follow a governance charter that details the functions of the CoC board, committees, HMIS, staff, and also like how often and when is the charter going to be amended. And the charter must include your CoC's policies and procedures, your code of conduct, your board responsibilities, including like the recusal process if a board member maybe has a conflict of interest around a certain position. The governance charter must be reviewed and updated annually, and it must be developed in collaboration with the collaborative applicant and HMIS lead. The CoC also needs to have written standards. So you have to have written standards for providing CoC and ESG assistance. You should be establishing these in collaboration with your ESG recipients. At a minimum, the standards must include how you're going to figure out who's eligible for assistance, how you're going to prioritize folks for assistance, how you determine what amount of rent is paid for folks receiving rapid rehousing, and how you're going to prioritize folks for permanent supportive housing. So most written standards include these very minimum requirements and a lot more. They include, if you're a CoC or ESG grantee, what are the expectations about how you're operating your program? So the written standards must include these things, but often are much, much more thorough. So the written standards can go above and beyond, and really in many communities, the written standards are a guidebook for grantees on implementing their projects in compliance with HUD and the CoC. And that's definitely the case with the Western PA CoC written standards. They're pretty thorough, and they're really meant to be a guiding resource for folks who are implementing CoC and ESG programs. The Western PA CoC has a strategic plan, has a plan about how the CoC is going to implement its work and address homelessness. So the Western PAC updated its 5-year strategic plan in 2017, and it included some ambitious goals. The strategic plan will be updated, likely in 2021, 2022. The 6 goals of the strategic plan were: reduce the number of people experiencing homelessness in the CoC by 50% by 2021, end chronic homelessness, end veterans homelessness, reduce homelessness among families with children, reduce homelessness among unaccompanied youth, and set a path to end all forms of homelessness. The CoC is making progress on these goals, but still has a way to go. These are very, very ambitious goals. And then there were 6 strategies. How is the CoC going to accomplish these goals? So the strategies are: increase leadership, collaboration, and civic engagement to really expand the CoC's reach and work more effectively with folks across the CoC. Increase affordable housing resources, increase economic security. So that could be through folks increasing their income, accessing benefits, things like that. Expanding and aligning resources. So not only creating more homeless resources for folks experiencing homelessness, more housing, but also aligning resources. There's a lot of different funding streams and programs, and the CoC will be most effective when they're coordinating with all those other resources to really provide a streamlined, coordinated system. Retooling the homeless assistance network to really focus on preventing and diverting homelessness whenever possible, rather than, anyone who's at risk of homelessness kind of needing to go through the shelter system to access services. We've really moved away from that towards this prevention and diversion model. If we can keep folks out of the homeless system with a little bit of support, that is definitely the preference. And then lastly is enhancing data collection, really understanding the picture of homelessness in the CoC and increasing our ability to kind of analyze and understand what's happening. Last but not least for this module, who's who? You'll hear these names, you'll hear these acronyms, so we want to make sure you are aware of kind of who's who in the Western PA CoC. So we have the governing board, the Western PA CoC governing board. The governing board is responsible for oversight of all CoC activities. We'll talk more about the board in a future module. We have the RABs, Regional Homeless Advisory Boards. Each RAB is responsible for working to implement the CoC strategic plan and address homelessness locally. And there's two RABs in the Western PA CoC. We have the Northwest RAB and the Southwest RAB. We have DCED, which is the Department of Community and Economic Development. They are the CoC Collaborative Applicant and CoC HMIS Lead Agency. And lastly, we have DMA, which is Diana T. Myers and Associates. DMA is the consultant for DCED and really helps to kind of operationalize a lot of these CoC activities that are required by HUD. So responsible for supporting the CoC board and committees, coordinating the annual point in time count, the CoC NOFA competition, and supporting implementation of the CoC strategic plan. Thanks for joining us. We'll see you for the next module.